The purpose of the Ghana Health Service training video is to improve the attitude of the health workers in Ghana and to clearly illustrate what health workers should and should not do while on the job. The training video incorporates fictional dramas that are supported by true stories from actual patients. Ghana Health Service trusts that health workers will take the information in this training video serious so as to improve the quality of healthcare in Ghana.
Over the years, Ghana has tried to provide good quality services to people of this country and to make sure that every patient visiting our institution gets the best of care. But over the years, we've had complaints about attitude to work, especially attitude to our patients. I want us to live by our motto, your health, our concern. I trust that with this training, Ghanaians will find a new health service. This training video is to ensure that our workers are brought up to appreciate the strategy we've brought into place with the development of the 5-year program of work. It is our vision that every person living in Ghana will be well cared for.
In today's rapidly globalizing world, customer care is being applied to more than just business. Many public sector organizations, including healthcare, are incorporating this notion into their services in order to build upon their professionalism, reputation, and quality of services. As a collaborative initiative, the Ghana Health Service and EcoBank Ghana are teaming up to help hospitals across the country improve upon the customer care relations between hospital staff and patients. The Ghana Health Service developed the acronym CARES to easily teach staff about the 5 important aspects involved in customer care.
Good afternoon, sir. My name is Favor. I'm the pharmacist here. Do you need any assistance?
But I'm the doctor. I was a member of the Obama Mahato.
Number 2, my prescription. Prescription is a paper kitwa fita white. And no doctor need them now for count area. And no now Baba Jiwahano, but true in the Egusu. It's behind no now the Baba. Yeah, just one my Druno.
Patch away.
Patch a Benjamin Ado.
Patch on.
Patch on Mammy Brick a crabby mayor word, Mamma.
Communication is a key component of customer care when dealing with patients. It is important that communication lines are simple, concise, audible, and clear. Speaking in the local language often helps with this. In addition, simply explain terms to patients so that they are able to understand. Also use descriptive language, as many patients are unfamiliar with medical terminology. To ensure patients understand what is being said, ask questions that will elicit responses.
From my personal experience, I lost my husband's brother due to lack of communication, in the sense that he had pneumonia, but then they told him to go and do a lab test and an x-ray, but they should have given him an idea of what really is happening, so that the person, even though maybe you might not know without the lab results, might not predict the disease, you have a full knowledge of what is happening to the person. So you can tell the person this is what is happening, so that the person would know that, well, it's serious, so I have to take. But because they didn't communicate that to him, he didn't take it serious, so he didn't do the lab test, and eventually he died. Effective communication between the health workers and the patient is important because it helps the patient to know what is happening within the body and the necessary measures that will help the patient to prevent any further disease coming.
Urado. Medasisi wenya emre ne ntobwase amano. Me pacho eduro na doctor trauma o. Enu e friend no diclofenac. Eno no osi wudidi wi a anopa wo benom baako. Enwumre so wudidi wi a wo benom baako. Wo benom a kosi se ebesa. Kusu no na wo nan no benom ni nyina wi na nyina enko.
Pacho medase pa.
Me pacho wo nsem bi se bibie wo ana.
Pacho David.
Aha, me pacho me kan sen.
Pacho wo say menum baako anopa. Baako enwumre. Se me didi wi a. Pacho medase.
I need to see a doctor. My daughter is experiencing a sharp pain in her stomach.
Okay, wait for me here. I'm going to call somebody to help you immediately.
Okay.
Let her sit down. Since walking will rather intensify the pain. Madam, I want to ask you some few questions. What is the name of your child?
She's Nanama.
And when exactly did the pain start?
She told me yesterday she was having some problem in her stomach.
Nanama, I'm Nurse Ruth. Your mom just told me you have a sharp pain in your stomach. Is that so? Everything is going to be okay. I'm just going to ask you some few questions to know where the problem is.
Being attentive is another important aspect of customer care. When dealing with patients, health workers should pay attention to the needs of patients by responding quickly to their situation. Additionally, being attentive also requires good listening skills and the ability to show patience and compassion towards patients.
There was this one time I got to the hospital, and when I got there, the nurses sat me down and gave me their ear, listened to me to find out what was wrong with me. So I told them what I was going through, and they listened to me well and jotted some things down so that they could present it to the doctor for further diagnosis. Normally you hear stories about nurses not regarding patients and not taking into consideration the pain and what goes on, or what the patient goes through, especially in emergency cases. But in this particular case, they gave me that kind of attention by listening to me and asking me questions. They show that care. The nurses paying that attention to me made me feel good, and I had that assurance that my health was in good hands.
From the information gathered, I guess your child is having food poisoning. In the meanwhile, I'm going to give her a cup of water to drink so that I'll go and call the doctor.
Thank you very much for attending to my daughter. I was really worried about her condition, but your being helpful has really calmed my nerves. Thank you.
You are welcome. Kanama, goodbye.
Next.
Good afternoon, madam.
Good afternoon.
I need to fill out a new form for my health card. Please, I'll need your assistance in filling this form. Madam, I said I'll need your assistance in filling this form.
The instructions for filling the forms are on the sheet. Can't you read?
Is that how to talk to the elderly? Look, don't you have respect for elderly? Look, I have your size in my house.
I don't have time. Can't you see how long the queue is? As for you.
As for me, is that how to talk to the elderly? You better respect the elderly, eh?
Next. Your name?
Grace Omwa.
You wait. I have 2 grades from West on my file. Are you the one with HIV/AIDS?
Can you please give me my file, please?
Next.
All patients, irrespective of their profession, class, age, or religion, should be treated with respect and dignity. This means addressing individuals by their name and using formal titles such as
Mr. Yashiman
when necessary. More importantly, health providers must respect the privacy of patients by ensuring that patients' personal health information remain confidential.
Even this morning, as we are at Old PD for our folders, you could see some of them will come and they'll go straight to the place, get their folders, and maybe you'll be there waiting, you can get a folder. Why it should happen so? They're supposed to treat we good, right? It shouldn't be a discrimination, like, oh, they will give you good, or like they will give your services good, and your services will be very bad. It's not good because you're all human. You're all human, you have the same blood in our blood. Nobody's better than any, right? So it's supposed to be the same to each and everyone here. So first you come to the hospital, that's what should happen.
Madam, I'll need your assistance in filling of this form.
Okay, sir. But if you be a little patient, I can get you someone who will help you fill out the form.
How long is it going to take?
It wouldn't take much time. Next.
Hello.
Hello, madam. May I know your name, please?
Grace Omwa.
A moment, please.
Okay.
Please, madam, I have 2 grades from birth on my file. May I know your date of birth?
21st December 1981.
Here you go, madam.
Okay.
And thanks for being patient.
Have a nice day.
You too. Next.
Sir, please, can you help me with the X-ray department? It seems you are lost.
Yes, sir. Sir, can you help me with the X-ray department, please?
I don't exactly know the X-ray department in this hospital, but I can take you to the information desk.
Okay, sir.
Let me help you with your bag.
Thank you very much, sir.
How may I help you, please? Yes, please. Yes. Yes, please. Thank you very much, sir. Thank you. Sorry for keeping you waiting. How may I help you?
I'm looking for the X-ray department.
Make a left through the door.
Yes.
And on your left outside, you see the X-ray department.
Thank you, madam.
You are welcome.
Being enthusiastic refers to one's eagerness in taking initiative to help others. It is also having a positive attitude. Enthusiasm can be demonstrated through something as simple as a smile or showing interest in the work. Working in an environment where individuals are enthusiastic contributes to a positive work ethic amongst colleagues and also helps to foster teamwork. Employees who consistently display such exemplary enthusiasm are often rewarded and recognized by others.
An example when I showed enthusiasm towards a patient who had stroke, who couldn't move his body, neither talk, neither feed himself. So I was the one taking care of him, taking his bath, feeding him, changing his diapers. And then when I finished with that, I was really happy. And the family did appreciate what I did for him.
Good morning.
Good morning.
I think he has an appointment with you.
Heidi, did you find trouble finding the X-ray department?
Not at all. Kobe was helpful and helped me find it.
That is your bag.
Thank you, Kobe.
You are welcome, sir.
Please have a seat.
What's wrong? I think something is wrong with me.
I know you're not due to live there for a month.
No, nurse. I woke up this morning feeling pains in my stomach. Please tell me my baby is okay.
Come and be on the bed. Let me examine you. Does it hurt when I touch here?
Yeah, slightly.
What about this place?
Hey, nurse, I feel pains everywhere.
Then let me have a look at your file.
Okay, nurse. Oh, nurse, you wouldn't even take a look at me. It looks like you are in a rush.
Have you had any complications during your previous pregnancies?
Not before with my 2 kids. I don't know what is happening to
Then
me.
I suggest you go to the hospital.
I'm scared.
I'll call the nurse to take you to the hospital. I have so many patients to look after, so I'm going. I have no time.
Safe care is the responsibility of health workers to ensure that the patient's health is never put at risk. It is important that health workers follow safety precautions and protocol at all times. Such precautions and protocol include using sterilized equipment and handling the patient with care. Health workers should also make sure they perform a thorough consultation by accurately reading through the patient's medical file and asking about their medical history. It is imperative that safe care be at the center of every contact between health workers and patients. This will ensure that patients receive the proper care and treatment they deserve, and also help to avoid unnecessary complications with their health.
The last time I went for an injection, I was seated in the room. The doctor put on his gloves. He took my arm, cleaned it with a cotton swab. Right. He then took a new injection, took the sample of my blood, cleansed it with cotton swab, then placed on a bandage. Afterward, he disposed of the used injection. Then he asked me to wait outside. I trusted the doctor because he went through all the procedures he was supposed to go through. He explained to me what he was doing. He took his time. He was gentle. He was gentle with me. And the equipment he used, the injection was new. Everything was new and all. So he disposed of the needle afterwards. I knew I didn't stand the risk of being infected with anything. It's important the doctors practice safe care so not to jeopardize the health of the patient.
Let me help you nicely onto the bench, eh? If you don't fall. Sit on it. Let me help you with this. I'm examining you, to detect whether there is any abnormality or what you feel,
I feel pain slightly.
Okay, it's not hurting. Gently. Sorry. Okay, let me check your file.
Okay.
Checking your file, and after your examination, I still can't detect your problem. So I'll call the hospital for further investigations.
Yes.
But I'll wait with you until they come to take you away.
Customer service within the hospitals must begin and end with care. Through effective communication, attentiveness, respect, enthusiasm, and safe care, workers will fulfill their respected duties while helping to improve the confidence of patients in the healthcare system. As leaders in providing quality customer care, Ecobank Ghana is helping the Ghana Health Service reach their goal of providing quality healthcare through improved customer care.
Ecobank Ghana has always had a very good reputation in quality customer care. From the very beginning when the organization was established, the core of our operations was customer care, and that was what has brought us this far. Customer care cuts across all segments of the economy. It's not only in business, including the hospitals, the service areas, wherever you have people around, there is customer service there. And we believe that it's needed everywhere, including amongst colleagues. We are really very proud to be associated with the Ghana Health Service, and also very happy to be working together with them to improve quality customer care across the nation.